Hi, everyone. I'm Ryan Lizza, and I'm the Washington correspondent for The New Yorker. Joining me today for our discussion on healthcare, we have Neera Tanden, who's now counselor to the Department of Health and Human Services, a former top policy advisor to Hillary Clinton. Elizabeth Edwards, a senior fellow at the Center for American Progress, where she focuses on healthcare issues, and incidentally, a New York Times bestselling author. Her new book, Resilience, comes out May 8th. And if you want to hear more about that, she will be on the Oprah Winfrey Show on Thursday discussing that. And on the far right, we have Dr. Howard Dean, the former chairman of the Democratic Party, 2004 presidential candidate. It's like a local chapter of the DFA here. And a former governor of Vermont. We're going to talk about the next 100 days. So I've been asked to briefly recap what has happened on healthcare in the Obama administration in the first 100 days, which is actually quite a bit. We had Tom Daschle, who was originally tasked to lead this effort, had to withdraw his nomination because of some tax issues. Eventually, there was a replacement named for him, the former governor of Kansas, Sebelius. After a very wild debate inside the Obama administration, the Obama team decided on what they call a down payment on healthcare, and they came up with about $600 billion in cost savings and new revenue to pay for a universal healthcare plan. And now the debate, I think just this week, is really starting to get interesting, and that's what we're mostly going to talk about is what happens now. I think everyone's familiar with the problem. We have 46 million uninsured, 25 million underinsured, and skyrocketing healthcare costs. So I want to start with each one of you, starting with Dr. Dean. Lay out for me, if you were designing this plan, what would the core components look like?
Well, actually, I have to say that
putting aside politics to the extent that you can.
I really don't want to do that, and I'll tell you why. The reason that the Democrats have failed to have health insurance in this country since Harry Truman first proposed it is because we always put aside politics, and therefore nothing ever passes. I think Obama's plan is the best plan I've seen. I've been doing this stuff since 1975, when I was in medical school, because it can pass. It gives people the choice between being in a single payer, like Medicare, or holding on to their private insurance. In other words, if you like what you have, you can keep it, which has been the big failing of every other plan. Every other plan, we've imposed something that makes academic sense, but never has the votes to pass. This, I think, has the votes to pass. So I'm, as long as they have a public option and that people can choose a public option, because that's real reform. Putting more money into what we already have is not real reform. Then I'm in favor of it, and I think President Obama's bill does exactly that, as long as what he is proposing is what ends up passing.
So your end-all be-all is a public option. It has to have that.
Has to have the public option, a real public option, not one that's sort of run by the insurance industry or something like that. It's to be a real public option that people can choose.
Elizabeth?
Well, I'm more of a dreamer, I guess. I was at a conference, Comprehensive Cancer Network conference, where someone mentioned that they had been at 1,000 conferences, and at one of them they'd been to, a doctor had asked the question, what is it that you want? I mean, and it seems to me that's the first question we should be asking ourselves about what it is that we want in a healthcare system. Because I don't think it's so much, from different perspectives, from the doctor's perspective, from the patient's perspective, from society's perspective. We're now getting a test of that with the swine flu on the larger group of people who are affected by the healthcare of somebody who lives next door or down the street. So what is it that you want? And it seems to me that what we want is total. We want everyone to have access to health care. We want a variety of screenings to be available in a very accessible way. So you don't have to make an appointment for a mammography 4 months in advance and then park your car 2 miles away and go. You want to make everything as accessible as possible so people are actually getting the screenings that they need. They need every once in a while, and Howard, there's nothing wrong with wellness. I remember one of the first times I heard wellness was when it came out of Howard's mouth, but it's got to be part of a broader way of thinking about our daily lives. We're getting to think about our daily lives now in a new way because of economic situations, but maybe as we do, we can find ways to incorporate wellness into it. And we need to find a way for the medical system to work so that, so I want to see in a way that's efficient. You want to make certain that you have doctors in primary care instead of all your doctors in cardiology. You need to spread this out, so because of the pay differential, you end up having a lot of specialists, but very few internists. We don't have enough nurses, but even if every nursing class was full, we still wouldn't have enough nurses because we don't have enough nurse educators. So you need to think of the whole problem and say, if we're going to get the system right, we have to fix it at all these different levels. So I want to see a health care bill that looks a lot like Senator Obama's bill. Frankly, I get to say my husband's bill, because I think he was the first to make this in the 2008 primaries to make the suggestions that we have the system that includes a private provider, public provider as well as private providers, and I want to see a renewed emphasis with access for everyone, which is going to mean a mandate, and I want to see us have a renewed emphasis on diagnostic and tests and screening. Because if we can identify these conditions earlier, we not only save money in the system, but we improve people's lives at the same time.
And you're the same question. And as someone who works for the Obama administration,
Well, I think there are three big overriding issues that both Howard and Elizabeth talked about. But first and foremost, I think we have a healthcare system where costs are out of control. Premiums have literally doubled in the last 8 years. Families, especially in this economy, their wages are squeezed while healthcare costs are rising dramatically. That's a problem that everyone is experiencing, and we have to get a handle on costs. But we also have a real moral tragedy in our country where 46 million Americans don't have health insurance, 8 million more than in 2000. And the great work that the Center for American Progress, we've seen that as we are going through this recession, our deep economic challenges, we are seeing that hundreds of thousands of people in addition are losing their health insurance. So that these problems are exacerbating at a tremendous rate. And so we definitely have to address the issue of coverage and have a plan that covers all Americans. And we also have to improve quality of care, improve access to primary care doctors. We have to ensure that the system works for everybody. We're improving the system of care as we ensure that we're covering all Americans. And so we're looking, I think the goal at the end of the day is to have a reformed healthcare system where consumers and patients and doctors and nurses are put forth and are really the drivers of reform.
You've laid out a lot of very general principles, which leads to this question. What are the lessons that the Obama administration has learned from the failed effort of the Clinton administration, which was less general and more specific, one might say? But what are the general lessons that you guys talk about inside the administration? What are the things, the pitfalls?
I think there are several ways that we are going about things differently than in the past. And, we are in a very different time in our country. We see stakeholders come forward that really were opposing healthcare reform in the past. So we have, the insurers are acting differently than they did 15 years ago. Business, and I think a major player as CEOs and businesses are really at the table recognizing that healthcare costs are growing out of control. So I think there's been a broader effort to reach out, get ideas from the Congress on both sides of the aisle. We've had a series of stakeholder meetings where we're bringing people into the White House, televising our meetings, putting them on the web, really having honest conversations with people from with various views and various ideas. And obviously, as the president has said, he's put forward broad principles, but the Congress is really leading the way in writing the legislation. They are working very hard. We have tremendous momentum. The committees in the House, 3 committees in the House have jurisdiction, are working together. It's almost unprecedented for that to happen, that they are planning to report out one bill. Senate Finance and Help Committee, Senator Kennedy, are both working in close coordination. And they are working as we speak to hammer out issues, and hopefully we'll see legislation in the coming weeks. But it is obviously a different thing for the Congress to lead the way on these issues.
Elizabeth, I wanted to ask you this. One, I think a lot of people in this audience will be interested to know how your personal health is, since it's been such a national issue. And then is there anything with your experience over the last few years dealing up close with the healthcare system. Has it informed your sort of take on the debate, or what you bring to the debate now?
First, my own health, and that is that, none of life is a straight line, it turns out, like you thought it was going to be. And the same thing is true with cancer. It's up and down. And so I've gotten some reports of where things have been stable, and some reports where things have gotten a little worse, but I'm back on the stable line again, and hope to stay there as long as I can. And it's one of the things that I've been so one of the things that's pleased me about our inspector coming up with the Democratic Party, he's been a real advocate for NIH money. And obviously it's not just cancer, but all of these diseases, there's going to be answers for them. So I'm very optimistic that we've got a coalition now to make certain that we're going to put the right amount of money behind research dollars. What I've learned, honestly, I remember sitting one time, I have sort of set stories I tell, I never tell this one. I was sitting there waiting to get an MRI or a bone scan or something. And this is a room of not particularly cheerful people. And there's one woman who's sitting on the phone, and her daughter had been taken in for some sort of a test. And they stopped it before she started because they couldn't, the health insurer wasn't approving it. And so one of the things, so this mother is on the phone as I wait 45 minutes or so for my test, the whole time trying to talk somebody into paying for it, and the hospital is sending somebody in. Maybe they can figure out a way from their funds to pay for it, although hospitals are strapped anyway. So they're having this struggle play out right in front of you. And I see it, I saw it was very vivid that time, but you see it in different forms all the time if you spend a lot of time in hospitals, as I do. So one of the things that I've been convinced of is not only do we need to do healthcare reform, but it needs to be partnered with a patient's Bill of Rights so that doctors and their patients are making decisions about what appropriate treatment is. So we don't have a case like Natalie Sarkeesian in California, where the health insurance company, not the doctors who had applied numerous times, or the healthcare team in general who had also applied to the insurer numerous times, or the family, the insured, also appealing to the health insurer, who said no, they wouldn't pay for a liver transplant. And so this 16-year-old girl died. You want to make certain that the decision makers are not accountants, that the decision makers are medical professionals who are actually seeing the case. So if we don't partner a patient's Bill of Rights, I'm a little worried about it. Can I say one thing too about what you asked, Nidra, and that is, I remember Hillary Clinton sitting there being quizzed, and I thought how brilliant she was in '93. She was answering the questions with such ease. I remember one day watching her, she wore a very pretty yellow jacket. I mean, I really see it in my mind's eye. Next to her, however, is a pile of paper about this big. That's the bill. The visual was so horrible. The bill is this big. And, I think one of the things we've learned from that is that people, when the health insurers were then saying, do you want the government and all of their red tape wrapped around you so you can't get health care? And here's what they can point to. We've learned that those visuals really do have an impression on people. And I have no idea what Senator Obama's health care plan looks like if it were printed out page by page, but I know that I'm unlikely to see it as well.
I think in the budget it took up about 2 pages.
I think it might have been 3.
But, all right, Governor Dean, your big issue right now is to fight for this public plan. What your friends on the other side of the aisle will say is that this will destroy the private insurance industry in America. How does Aetna or any of these private insurers compete with a government-run plan that does not need to make a profit? And should we be concerned about that?
Well, no, we shouldn't be concerned about that. Look, since when is it in the Constitution that companies are entitled to be as inefficient and rapacious as they want to when they're selling products? Look, we're not going to drive the private health insurance companies out of business. That's not going to happen. In fact, I actually believe, like most industries, they haven't thought this through. There are ways that they can make money when there's a public option. First of all, the public option can't be a Cadillac. It'll look much more like Medicare, and therefore they'll have a product to sell for those who want more, and there's always people who want more. Secondly, a good percentage of people will choose to stay with the insurance they have. That's their right under the Obama plan. That's why it's so great. Harry and Louise can't come out and tell you the doctors are going to you're not going to choose your doctor because you can keep what you have if you like it. And a lot of people do like what they have. There's some really interesting research that show that people would pay almost twice as much to keep what they have initially. This is why health care hasn't passed in over the last 60 years is because we forget that 80% of Americans have health care. You know, health care is like Congress. People hate Congress, but they like their congressman. Well, they hate the health care system, but they like their doctor, and they like the kind of health care they get if they get it, which means 82% of people in this country have health insurance. You can't fool around with that. This is this is worse than taxes. That's how personal this is. So what the president's bill does is say, if you like what you have, you can keep it, and a lot of them will. Otherwise, we have something for you that's more efficient, that's guaranteed to go with you wherever you go if you lose your job or you've taken a different job, that gives a great break for small businesses, which generate 80% of all the new jobs in this country, which is something we could use right now. It is a great bill, and it is worth fighting for, and if we have to do it in reconciliation, we should do it.
The Progressive Caucus, the most liberal caucus in the House, has circulated a letter saying they're going to tell their people not to vote for a health care bill if it doesn't include
That's exactly
option.
right.
Is that where you are on that?
Absolutely. There's no sense in spending $634 billion as a down payment on something that just rearranges the chairs in the deck of the Titanic. That's what we're going to be doing. Putting more money into private health insurance makes no sense. They're already making plenty.
I don't know if you can answer this or not, but if a health care plan comes to this administration without a public option, is Obama going to sign it?
Well, the president obviously supports a public plan. It was in his health care plan. And what he said himself is, in many ways, he sees a public plan as a way to keep insurance companies honest.
Right.
We want to make sure that we have a system that works for everyone. It's a guaranteed benefit. In many parts of this country, right now, there's really one plan that operates. It's another way to operate, to really give people a choice. So there are many good reasons for a public plan. Obviously, the president is having a conversation with the Congress. We're working with them very hard, but they're leading the way. And he's really said he's wanted to have an open conversation and hear from many sides. He himself has obviously supported a public plan. We are having those conversations. We're hopeful that will go through, but there's no single issue at this moment that we've said we'll veto over anything. Right. So I can't really say, we'll veto over this or veto over that. We have to see what the final bill emerges, but obviously we're supporters of a public plan and hope that emerges in the system.
This is the sort of key debate this week on healthcare, the public plan, and Schumer has announced something this week that would essentially, he's trying to ease some of the concerns of the insurance industry, and he's basically saying, why don't we look at a public plan that plays by all the same rules as the private plans? And I don't know if any of you have had a chance to look at this proposal in detail, but it seems like what the debate's coming down to is a very, very strong public plan, something very similar to Medicare, and something that's basically a little watered down and would appease the insurance companies. So my question is it worth doing a public plan if it has to have all the same inefficiencies and rules and regulations that the private insurers?
It's not, but Schumer's proposed.
And what's your position on his plan?
Well, I haven't seen it. I've read it in the paper, and that's about it. So you can't comment on something you haven't seen. But the plan, it's not a ridiculous idea. We don't know the specifics of it. It's not unreasonable to think that as long as we're allowed to negotiate for prices the way the private sector is, the benefit of having a public plan is not so much what they pay the doctors and all that kind of thing. Here's the benefit of having a public plan. The Medicare agency, or CMS, doesn't have to pay executive salaries. It doesn't have to pay shareholder return on equity. It doesn't have to pay advertising costs. And therefore, in Medicare, 96 cents out of all the money that you put up gets spent on health care. In the private sector, the very best insurance companies in the nonprofit world do 12%, and some of them do 88%, and some of them spend 50% of every dollar on health care, and the rest goes to return on equity, et cetera, et cetera, et cetera. So what we principally want with a public government-administered plan is efficiency. This is one business where the government actually runs things much more efficiently than the private sector. And that's perfectly obvious by the fact that their product has gone up at 2.5 to 3 times the rate of inflation for 30 consecutive years. It is destroying our competitiveness. People would rather invest in Canada, where their businesses don't bear the price of having to pay for health insurance that goes up at 2 or 3 times the rate of inflation every year, than they would invest in America. And we're not going to have jobs in America as long as we have a health insurance system that is inefficient and badly administered. So I think the American people ought to have a right to choose their inefficient, badly administered system if they want to. But I also think they ought to have a right to do what they can't do now, and that's choose a public, well-run plan.
It seems kind of funny, but the big debate in the Democratic primaries over health care was, because this was the only difference between Obama and Hillary Clinton, do you have a mandate? Do you not have a mandate? Elizabeth, what's the case for having a mandate? You support having a mandate.
Yeah,
and explain what a mandate is.
Mandate, everybody's got to buy health insurance, and you, based on your salary, you have to contribute at least a certain amount of the salary to a certain percentage of your salary to pay for health care. And the government might, and I believe in President Obama's plan, I know in my husband's plan, the government did subsidize people at different salaries in order to make certain that they could afford health insurance. But everybody has to buy it. And of course, you get a lot of people, I don't want the government telling me what I have to do. But you actually see people benefiting right now in Massachusetts from having it, because even people who didn't have it before, some of them are finding out they were sick. I did a New York festival with Dr. Gawande several months ago, and he told the story of someone who had come to him angry that they had to buy health insurance, but saying, if I'm going to have to buy it, I'm going to get something out of it. And so they went and found out that, in fact, he had the husband had a cancerous tumor in his throat. We're going to find that people need treatment before they get to Medicare, and it's taxing Medicare. We're going to find out earlier and treat those people. So you want to make certain there's a mandate, so you make sure you have universality. You're not going to have it without a mandate. And there's one point on which Karen Ignacio, who is the chief lobbyist for the health insurers, and I agree, and that is you can't require insurers to cover pre-existing conditions if you don't have a mandate. Because what you're going to find is somebody is in the ambulance on the phone to State Farm or whoever. Or United Healthcare, I'd like to buy a health insurance policy. Or I wait till the biopsy comes back for the cancer. Why should I be paying until I know my health care is really expensive? It would actually be the coverage of a pre-existing requirement that they cover pre-existing conditions, which is important to so many people. When we talk about the underinsured, I don't think we're even counting the people who are finding out that some of their coverage, they're just underinsured generally. But you've got also people with pre-existing conditions. It's not, I can't believe these words are coming out of my mouth. It's not fair to the health insurers, whether it's the public system or the private system, to allow people to sign up only when they find out that they have an expensive condition. You can't buy fire insurance once your house is on fire, and the same thing ought to be true here. It just doesn't make any economic sense.
Governor Dean?
Well,
you don't think we should have a mandate?
I don't. First of all, it's not a live or die issue like the public plan. I think it can work with a mandate or without a mandate. I did not include a mandate in my plan in 2004, and I don't support one now. Although Elizabeth is absolutely right from an academic point of view, it's only fair. You are. You are.
I think that's called damning with faint praise.
No, it's not meant to damn you with. Here we are in an academic setting. What could be worse?
That was very practical. Mine's very practical.
It is practical, but the problem is Americans. If you tell a 26-year-old kid that they have to have a mandate, they're going to spend the money on a Harley Davidson, and they're not going to get the mandate. So my problem is I don't think that it's going to work because I don't think people will pay any attention to it. But there's the way to get around the issue that you talked about is, first of all, I agree with something Barack Obama said during the primaries, which is there are very few people who are responsible people, married with kids, older people, who are not going to pay what it takes to get health insurance with some government help, even if they don't have much money. They're going to do it because they're going to be afraid they're going to lose their house if they don't, even if they can sign up at the last minute or something's going to happen to their kids or whatever. The target population for the mandate, which both needs it and it won't work, is under 30. And frankly, if I were doing this healthcare system, and this won't work today, but maybe someday it will, I would do what they do in Canada for people under 30. I'd give them a card at birth or upon attaining American citizenship, and there you go. You have free health care. And the reason I would do it that way is it doesn't cost anything. For under 30, only two bad things happen. One is a malignancy, the other is an accident. Neither happen very often. It's an incredibly inexpensive group to take care of. And when we did universal health care for everybody under 18 when I was governor, we did it by expanding Medicaid, so I'll grant you that the federal government paid for 60% of it. We didn't have to raise taxes. And we didn't have to have a mandate. 99% of all the kids in Vermont under 18 are eligible for health insurance. 96% have it. That means we can't find 3%. They didn't sign up for whatever reason. I think we can live with 3% uncertainty. And I think it's going to be hard to pass. And I think Americans resist being told what to do and being told that they have to lay out money So I do agree with Elizabeth in terms of if I were designing a plan, this makes the most sense. I just don't think it's practical, and I want to get something passed. So I'm just not willing to take on a mandate and the public health insurance piece. If I have to choose between them, I'll choose the public health insurance piece.
Now, Nero, one of your jobs when you were working for Hillary Clinton on the campaign was to gather all of the reporters and attack Barack Obama for not having
But he got over that so well.
And then you went to work for Barack Obama in the campaign, one of the few Hillary Clinton people that went to work for him. Mm-hmm. Now you're in his administration. What is the current administration view on the mandate?
Well, I mean, the president feels strongly that the most important issue, the reason people don't have health care is because of the cost. And so we have to reduce the health care costs in order to address issues of coverage. And he recognizes, again, that there are a lot of ideas on the Hill and there are a lot of ideas in Congress about how to cover people and how to get there, how to cover all Americans. And he's committed to covering all Americans. So, you know, if these ideas percolate through the system, you know, we will look at them as we go. And obviously, people on the Hill have very strong views on these issues, and we'll discuss those. His own view is that the most important issue, again, is to reduce costs. But these are ideas that are floating around, and we'll see as they come through the system.
Cost is exactly the reason, though, that it's really important to include the mandate. Because if the reason insurance works is because people who need it and people who don't need it buy it. And therefore the cost is distributed widely. It's, you know, almost a social justice theory that the costs are distributed widely. This is true for health insurance, for car insurance, for fire insurance on your house. Some people are going to get fires, some will not, and therefore the system can work. We'll all pay for the one fire by our insurance. If the only people who are buying the insurance have their houses on fire, then it doesn't work because the cost has to be so high. And so these two things have to be married together in order to keep the cost low, which we all know is the essential piece to making healthcare reform work at any level.
No, I hear that point. Obviously, I would just say that we are envisioning a system where we will have large-scale subsidies to people to buy health insurance. It was part of all three plans to have large, really strong subsidies through a tax credit or other means for people to buy health insurance. So you will see large numbers of people come in who are insured under any of these systems. And the question is, how do you get to everyone? But we're all envisioning a system where you are reducing costs a great deal because you will have a large number of people coming in, not just the sick when they're sick, but people who, you know, families who can't afford coverage now who want to ensure that they have it and they'll be better able to afford it, so they'll be part of the system.
Can I ask you the Elizabeth and Howard question about this? Does the Obama administration's sort of everything's on the table, willingness to talk about every option, does that worry either of you from the perspective of the plan that you guys would like to see?
Good thing there's a Democratic Congress.
Yes, there's a Democratic Congress. It would worry me a lot more if there weren't now, and I'll breathe a little bit easier when Al Franken is seated. But,
who knew that Al Franken's role in life would be the secure of health care for all Americans?
Maybe Al Franken thought that.
I think the House is going to pass a very good bill. They've got all the ingredients. I think the Senate's going to be problematic. Max Baucus was quoted today as saying the only way you can get a mandate is to pass it with reconciliation. A public health insurance plan is to pass it with reconciliation. You know, I keep hoping the Republicans come to the table, and I think right now they're saying they won't, but I think some of them will. At the end of the day, it's going to be hard to vote against a health insurance bill if you want to go anywhere in 2010. So let's just see what happens. Thank you. .com.
In some way, this conversation and the whole healthcare debate is partly putting the horse before the cart, or the cart before the horse. Excuse me. How are we going to pay for it? The revenue ideas that Obama put on the table were basically ignored by Democrats in Congress, right? This idea to at least put a down payment of $300 billion on the table by lowering the value of deductions, of tax deductions for high earners. Wasn't in the budget. It seems like there's very tepid support in Congress for that. What is everyone's favorite method of raising the money for this plan?
Carbon tax and gas tax. 10 cents on the gas tax and a small carbon tax. It's a very good system. One, it deals with, which has only partially related to health care, global warming. Obviously, people will change their habits. Two, you can rebate the money to the people who need it the most. The people who get hit the worst by the gas tax are poor people, especially in rural areas like mine state, where the poorer you are, the further you have to drive to get to work, because there's no jobs in the rural areas where they can afford houses. Those are the very folks that need help with health care. So you're taking their money at the gas tax and refunding a much bigger piece by helping them get health insurance, which most of them can't afford. So they come out ahead of the game, even though they're paying the gas tax. And at the same time, they now have a significant incentive to start carpooling. So everybody is a winner on that one. And the people who make the kind of money I make, we can easily afford another 10 cents a gallon. We were paying $2 a gallon more a year and a half ago. So I think a combination of gas tax and carbon tax is the best way to raise the money for this.
Would you take the money from cap and trade, that the money that cap and trade is estimated to raise $600 billion over 10 years? Would you take that money and use it to pay for health care? Because that's in the Obama budget already.
Right, and I think, yes, the answer is, if that's, this gets us into a debate on cap and trade, which I'm agnostic on. I think it's important to transfer carbon output and savings from the developing world to the developed world, and it's very complicated. But the spirit of what he's proposed, which is to link climate change and the incentives for behaving better towards the environment and the funding of healthcare, is the right thing to do. Whether Congress picks a carbon tax or cap and trade, I'm relatively indifferent to. I have a small bias towards a carbon tax, but not a big one.
Elizabeth, do you have a...
I honestly don't care whether we write it. I don't care how we do it. I don't care whether we write a check to do it, or whether we're using savings that we get from from either new taxes or, not allowing taxes or allowing taxes to expire that we currently have. It doesn't matter to me, because I think that we're a fast food nation. We want to get the benefit the minute we spend the dollar. That's not going to happen in healthcare. But 5 years from now, if we really are have a comprehensive system, and we're really doing the kind of screenings we need to do, we're going to see Medicare savings almost immediately. We're going to see savings in healthcare generally. Our health insurance should cost less, because we're going to be finding these conditions that get in bad shape, get us in bad shape. We're going to find those at an earlier date. Won't be so much subject to the threat of pandemics, because we'll have a more comprehensive system, and we'll have a system, hopefully, of health IT that's going to make certain that the CDC knows everything that's going on in the country. So we're going to, we spend that money today, however it is we raise it. We save in 10 years, 5 years, we see the savings. By 10 years, I actually think we could see remarkable savings. Medicare, for example, spends 70 or 80% of their dollars on people who have 3 or more chronic conditions. That may be. The other thing is the existence of the public plan will have the effect of reducing the cost of health care, and generally, because although, as Howard was saying, they have so much more overhead. A doctor told me that, and so I've not seen it in print. I tried to look for it, but because it's such a startling statistic, that in 2005, one of every $700 in this country spent on health care went to pay the president of United Healthcare. Pretty amazing, I think. Whereas health insurers private health insurance have been good in terms of figuring out new ideas and ways of doing things, which Medicare hasn't always been so great about. They've been very good. So you're going to see, I think, both of these have a good effect on one another. And if we drive the cost down, it's really not going to matter so much what kind of check we had to write yesterday, because we'll be seeing the benefit both generally in terms of our health and the cost there, but we're going to see it in reduced costs on businesses who are paying for health care, and we'll reap the benefit in lots of different ways. So I don't even care how it is we do it.
Neera, during the campaign, President Obama proposed paying for health care with the repeal of the tax cuts, the Bush tax cuts. In the budget, that idea wasn't present. He proposed this new down payment, the $600 billion that we talked about. Why the change? And is that still on the table? Is it still possible, from a budgetary perspective, to pay for health care with the expiration of the Bush tax cuts?
Well, the president did address the expiration of the high-income tax cuts during the Bush tax cuts, and he used that as part of deficit reduction in general, and part of his plan.
So that money goes to deficit reduction now, not to health care.
Right, but I mean, I think we should just take a step back. We put forward $634 billion. We all recognize that was not $634 billion over 10 years. We recognize that paying for a healthcare plan that reduces costs and covers all Americans will cost more money than that. And we've said that all along. And we're working with Congress to come up with additional revenue and savers. But I think the point Elizabeth was making is absolutely the right one, which is, our country pays 50% more for healthcare per person than the next wealthiest nation that pays for healthcare. And so we have estimates from 25% to a third of every dollar in our healthcare going to administration. We have a lot of inefficiencies in our system, and one of them is the fact that we have such an expensive system and we don't cover all Americans. So there's a lot that we can do as a country, and part of those issues started to get addressed in terms of reforming the payment system and in the budget proposals, but there are a lot of different ideas in the Hill about revenue and savers that really reform the way we pay in our healthcare system so that we're paying for quality and paying for quality care and paying to make people healthy instead of just addressing issues when people are sick. And so I think one of the things the president has always said is that he wants a system of healthcare, not sick care, and that's going to take time to move in that direction. But as we do so, we should be saving money over the long term, and we'll be able to use that money to recoup for healthcare.
Yeah, people think right now that they're not paying a tax associated with health care, but they are. If you have health insurance right now, your family is paying $1,100 more. Why? Than you would calculate if you were just paying for your health care. Because you're also paying for the health care of the uninsured population and the underinsured population. So when they go, that health care has to be provided, so the costs go up so that everyone is sharing it. So $1,100. I mean, honestly, if you could find some way to strap that money together, you could probably pay for the Cadillac healthcare system that we're talking about.
A lot of the healthcare debate, a lot of the consensus among Democrats has been sort of forged over, the last 15 years. But a lot of it happened during the Bush era. A lot of it happened when Democrats weren't in control, when it didn't look like you were going to have a Democratic president for a long time. You now have a Democratic president, one who's pretty popular. You now have a 60-vote majority in the Senate and a huge majority.
Close to 60 votes.
Close to 60 votes. Well, that's right. 59 and a half. And a big majority in the House. Shouldn't the sort of consensus that Max Baucus and some of these other folks came up with in a different political climate just be thrown out the window? And shouldn't Democrats just go for a big, bold, single-payer plan? Why are we trapped in a debate that took place and was forged under very different political circumstances?
First of all, over the last 4 years, I've at least learned to say that the chairman of the Senate Finance Plan should not be thrown out the window, because he runs the committee and I don't, and we clearly have to work with him. Look, this is a give and take process, and the problem is, obviously there are problems in Congress, but you're right, we should be able to overcome whatever problems we have in Congress. The problem is not Congress, it's the American people. The American people are traditionalists. They're conservative with a small c. They want change, but they don't want too much too fast. Look, you have to understand, the reason there are single payers in the world is because, and mostly in Europe, is because the healthcare systems were destroyed in World War I and World War II. And therefore, single payers arose during the wars. The government was the only way that people could have a healthcare system. So they were able to build on something that was already there. We haven't built on what was already there. We didn't have our healthcare system destroyed. It was already a privately based system before the war. And so therefore, our system kept going the way it was. That's the way of the American people. Now, we are in the middle of a financial crisis, and we're in the middle of a healthcare crisis. We have an opportunity to change. The one thing I don't want to do is blow it by ideologically attaching myself to some proposal. The reason I don't have to say anything nice about Barack Obama if I don't want to. And I really want to say that I believe in this plan, because it will pass. We don't have to have a fight with the people who are fearful of losing what they already have. And when you're talking about 20% of the people against 80% of the people who have something they like, we should tread relatively gently. If Obama's bill passed, that is a huge reform, and it will take place over years as individuals decide that they're better off in the public plan. And they won't all decide that. I think we ought to let the American people make this choice the way they want to make this choice. We will all be better if they do. And if the insurance companies and the Republicans aren't making the choice, we will all be better. So I think we ought to be satisfied with just letting the American people make the choice for themselves.
Elizabeth, if Democrats don't overreach now, when will Democrats overreach?
Yeah.
Isn't now the time for Democratic overreach?
Honestly,
Great verdict.
I'm not going to be in favor of that, obviously. I grew up as a daughter of a United States Navy pilot. I had a single payer. Basically, if you were a military family, you went to the military doctors, and you didn't have long lines. You got whatever you needed, your shots, or you got whatever surgery you needed, and it was taken care of. It worked perfectly well. So I have no objection to single payer. But I think about somebody who is like me, who was maybe in the middle of chemotherapy and told that right now everything's going to change. That insurance card in your pocket's not worth anything. Don't worry about it, though. And of course you'd be worried about it. I think that the existence of the public plan, if it's successful and well run, will either cause the private insurance to come down in their prices or get more value for your dollar, or it's going to result in more and more people joining the public plan. And as people see that their neighbor is getting good service and it's nothing to be afraid of. So I think that the way you get to single payer, the real way you get, is for people to feel comfortable with it, which this process will allow them to do. And the system will, if that's what people want, we'll get a single payer at the end.
The only thing I would add to this very briefly is, we've all gone through healthcare policy for a long time. There was a very long time where no one was even talking about covering all Americans and reducing costs. It is a transformative thing that we are hopefully months, not years away from a day where we have a healthcare reform plan passed this Congress and passed by the president. So I don't want to undermine that as a small accomplishment. This would be a major change and one of the biggest legislative changes for the Congress to see, and it is the president's #1 priority. So I think it will be a big change if it happens, and I think we're biting off a lot in doing it. So
We'll have to leave it there. Thanks.
Thank you.